Good afternoon. This is Carmel Angelo, Mendocino County CEO, and this is our Friday update on COVID-19. We have Dr. Doohan with us today, as usual, to go ahead and give the public an update. So at this point, I'll turn it over to Dr. Doohan. Thank you.
Thank you, Carmel Angelo. Greetings, Mendocino County. I wish I was here to tell you that the rapid pace of the COVID pandemic has slowed down, but it has not. This continues to be a rapidly evolving pandemic. And what we're seeing now is a community spread in Ukiah Valley. So I will be speaking about that in more detail, but to speak specifically, to start out with the Mendocino County data, and then I'm going to frame it in the larger region. So we now have 54 cases of COVID-19 in Mendocino County. Of these cases, 37% or 20 people are Hispanic, 31% are white, Caucasian, that's 17 cases. 2 out of the 54 are Native American, and 15 out of the 54 are in other ethnicity or unknown. So again, that's 54 cases with 20 individuals being Hispanic, that's 37%, and 17 individuals being Caucasian or white, and that's 31%. So again, we do have a great concern for our Hispanic population. And I always thank Jackie Orozco and her journalism for being on this live stream so we can make sure we get our messaging to our Spanish-speaking community. So 54 cases in Mendocino County. We've had a total of 6 hospitalizations. One of those was unrelated to the COVID, actually, the COVID was found incidentally on hospitalization for another reason. So of the 54 cases, 5 were hospitalized due to their COVID disease. So that's about 10% of the cases being hospitalized. That is a high percent, much higher than we would see with influenza, for example. So we have 54 cases, no deaths, and 5 individuals hospitalized due to their COVID. And to put that in a comparison to our outlying areas, Lake County has had 34 cases, so 20 less than us, and no deaths. Humboldt County has had 107 cases and 4 deaths. And Sonoma County has had 774 cases and 4 deaths. So we have 54 cases, more than Lake, much less than Sonoma. To give you a sense of the number of cases that are active and to give a feeling for what we do in our communicable diseases branch every single day, 7 days a week, I want to talk about specifically the numbers in isolation and quarantine. So these would be individuals of the 54 cases that are currently within their isolation period with COVID. So these are new cases, and the quarantine are the close contacts of those individuals. So we right now have a total of 18 individuals in Mendocino County in isolation, 18 in isolation of the 54. And we have 57 individuals in quarantine. So that gives you a sense of those 18 individuals that are in isolation. They had a lot of contacts. And this is what we're really struggling with in our county right now, is that we have cases and they're not isolating. They're contacting other people while they're sick or they're in the early part of their disease. Early on in the pandemic, we didn't see that. I would repeatedly come before you and say, we have a new case. That case went straight into isolation. They really didn't contact anyone of significance other than their household. That is not what we're seeing anymore. We have 18 individuals in isolation and 57 in quarantine. Those are the close contacts of those individuals. So the message, Mendocino County, is if you are sick, you need to stay home. And if you have been in contact with someone who has COVID, you need to be in quarantine. And we'll be talking about that more in a moment. Of course, one of the challenging things with COVID is there is a pre-symptomatic period. And in fact, some people are asymptomatic. And during the pre-symptomatic period, that's usually about 48 hours before someone gets sick. The asymptomatic period can be for the entire course of that disease, which we define as being 10 days from the date of testing. So it can be difficult to know when someone has COVID, if they are exposing other people to it. And that's why our facial covering in public order is so important. That's why social distancing is so important. That's why it's important to recognize that singing can transmit COVID far distances. We think up to 100 feet. That's why it's important, if you are going to be around other people to the extent possible, to do it outside with social distancing and having proper hygiene. All of these things that we've talked about again and again, certainly every time I speak to you, Mendocino County, all of these efforts are extremely protective. The social distancing, the facial covering in public, the hygiene, staying home when you're sick, and of course in our medical environments, wearing medical grade masks and having PPE in the medical environments. Regarding the greater area that we live in, the Bay Area, there's over 17,000 cases that have been identified in the Bay Area now, and 510 deaths, and that's about a 3% death rate based on the positive cases that we've tested. So that's very high, much higher than we see with influenza. So it's not good to compare COVID to influenza because this is a much deadlier and much more serious disease. And in fact, we have very little immunity in the disease in our population, and we don't have a vaccine. So we continue to be very concerned about COVID. This is early in the pandemic. We are nowhere near being through this, and we are still sheltering in place. We have moved into the phase 3 of the sheltering in place orders that have been ordered by the governor. And the 4th phase would be releasing of sheltering in place. We're early in the 3rd phase. We've just opened up our high-risk businesses, and it's very, very concerning because while we're having these outbreaks in Mendocino County, at the same time, we are opening up. And this is something that makes us very concerned. But again, our economy is part of our health, and we cannot keep our economy shut down any longer at this time. So we are needing to open up, and indeed the governor has allowed the opening up in the early stage 3. Early stage 3 that we've opened into are the higher risk businesses, which include lodging for leisure, and the governor has allowed that to open up. So that does open up tourism in our county. No matter what we do to limit travel in our county, people can come from outside our county into the county, and that will affect introduction of COVID into our entire county. We need to also speak about testing. There's 3 types of testing that we do. There's surveillance testing, there's outbreak testing, and there's testing for people when they're sick. For people when they're sick, our county has clinics and hospitals where individuals can go and be tested in the clinic or in the hospital. And that has been going on for months now. And we have great clinic and hospital partners in our county for which we're very grateful. So that's what happens when someone is sick and goes for testing. We always say, please call ahead. So in the clinic and hospital, the staff can be prepared and wear proper PPE and limit spread of COVID. The other type of testing is outbreak testing. That's what we're doing right now for several outbreaks I'll be mentioning in a moment. The third type is surveillance testing. Surveillance testing is for people that are not sick. It's for just sampling the general population to try and get a sense of whether we have community spread, perhaps find some hidden cases that might be asymptomatic or pre-symptomatic. We have been doing surveillance testing across our county for months now. We do have this resource called OptumServe in Mendocino County in Ukiah at the fairgrounds, which is extraordinarily valuable. We've gotten a number of positive cases from OptumServe. This is a resource that we are hoping to expand so that we can expand this resource to the coastal region as well. The issue with OptumServe is it's a fixed location. It functions 5 days a week, and we must have 132 tests a day in those 5 days a week in order to keep that resource. Currently, it's a free resource for us in Ukiah, and we're looking at the possibility of expanding to the coast, as I just mentioned, and these are discussions which are in process. But regarding the Ukiah OptumServe, this is currently free to us, and to keep having the ability to have this free resource, we must do at least 130 tests 5 days a week, and we are meeting that goal. So thank you to everyone who's come for surveillance testing to OptumServe. And we are aware that in the beginning, there were some bumps in the road about reporting the results and questions about how to access OptumServe, but those have really been smoothed out, and reports are coming in smoothly now to people that have been tested in OptumServe. So thank you, Mendocino County, for supporting us in our commitment to bringing surveillance testing. Regarding our outbreak testing, the recent uptick in cases was to some extent expected with the governor's opening up of early stage 3. And so what we did see are outbreaks primarily related to graduation parties that occurred for high school graduates. These were not parties that followed social distancing. It's very concerning. I will say that one of the parties led to a youth getting together with some friends, and then leading to COVID being spread to families. So this was a youth with COVID who went to a party, spread it to some friends, the friends spread it to family. The youth also participated in some group sports with some friends, spread it that way. So the message here is that if you go to parties, if you gather with friends, you play basketball, you hang out with a group of people, you may spread COVID to their families and to other people. And that unfortunately could even lead to someone being hospitalized or even dying. It's very, very serious. So we need to really emphatically state that we are not through this pandemic. And for those that gather into groups, you are threatening our community's health, our public's health. We do have a concept of social bubbles, and there's an infographic on our county website. The social bubbles concept is that you pick a group of 12 people that is stable for 4 weeks. And that group of 12 does not interact with others outside that bubble for 4 weeks. And within that bubble, people don't need to wear masks or facial coverings, and don't need to social distance within that bubble of 12. But if that bubble then has other interactions and it's mixing it up every couple days, there's no value to the bubble whatsoever. The bubble at this time, the social bubbles, are really there to help those people who want to be very careful with their practices, to be able to have social lives that are more sustainable over the long term, because we do expect this pandemic to be with us for another year while we wait for a vaccine. So if you take a look on our county website at the definition of these bubbles and understand that they are stable groupings for up to 4 weeks, and that might be a way that you would be able to safely socialize with other people. But getting together with a group of people for a party of 35 people and then going playing some sports and then hanging out with some other people is dangerous, as we're seeing with the outbreak that we're now trying and working so hard to contain in the Ukiah Valley that came from, as far as we can tell, graduation parties. There was big news this week from the state, from the governor. This was coming for quite some time, and the health officers across the state knew it was coming, but we were waiting for the governor to make a decision. The governor decided to make a statewide facial covering in public order. So this order says that when people are in public and they're coming within 6 feet of other people, 6 feet or closer, they should wear a facial covering. That means when you are walking down the street in your town, when you're going into a grocery store, anytime you're coming around other people, you need to wear a facial covering. Your facial covering protects others. When someone else wears a facial covering, it protects you. So if you choose to not wear a facial covering, what you're saying is, I don't care about the people in my community. I don't care to protect them in case I am harboring COVID and don't know it. Now, there are some people who are not going to wear a facial covering because they have a medical reason, or they're under the age of 2, which is another exception that the governor said, or maybe they are deaf and they need sign language interpretation. So there are reasons why people might not wear a facial covering. But I am seeing people not wearing a facial covering because they don't want to, and they don't think it's right to. And I'm telling you that we are seeing the outcomes of that right now when we are talking about 54 cases, with 18 in isolation and 57 in quarantine. This is the result of not social distancing and ignoring the sheltering in place orders. There are still sheltering in place orders in place for Mendocino County. Indeed, there are sheltering in place orders for our entire state in place because we still have the pandemic. The sheltering in place orders that I have are in line with the governor. We are opened up in Mendocino County. And so therefore we are going to see spread of the disease. That's unfortunate, but that is what comes from opening up. In my orders, which are currently being revised in minor ways for this Friday, I opened up, along with the governor, personal services, which includes nail salons and, for example, personal services on the face, which could include, for example, facial hair removal. What is particularly concerning to me about facial services is that the client receiving the services can't wear a facial covering. So they are not protecting the person doing the service. The person providing the service will wear a facial covering, but the facial covering doesn't protect the person wearing it. So in my order, I've made the recommendation that anyone who's performing personal services on the face should wear, in addition to the facial covering, some other form of protection, like a face shield or something, a plexiglass screen, or else that practitioner might be exposed to COVID from the client they're working on, something we're very concerned about. So the red line version of the sheltering in place order is up online, so you can see the changes. There's a summary of the changes up on our county website. The current sheltering in place order has an end date of July 3rd. What is going to be coming out after July 3rd is a revised sheltering in place order that's simplified. Let me modify that term simplify. What I'm meaning by that is there's a lot of language in the sheltering in place order now that's historical, that came because it built on the orders that I released from the very beginning. It wasn't a brand new document every time I released a sheltering in place order. It built on the old one. So there's a lot of historical information that goes back to the first sheltering in place order that we can now streamline in the sheltering in place order that I'm going to be coming out on July 3rd. The sheltering in place order on July 3rd will be in line with the governor, and it will also be in line with the reality in our county, where we're seeing outbreaks, we're seeing increasing numbers. And so it's not going to be a light switch where everything goes back to where we were before the pandemic. There are still going to be restrictions. There will be some minor changes to what you're seeing in the new orders that were being released today. So I would say that the new orders being released today are going to be similar to what we see on July 3rd, but we're going to be streamlining them so some of the language that is not necessary at this time can be minimized. So I believe that does cover everything. I'm looking at my notes that I have to share with you today. And I'm very pleased that we have our dedicated journalists on live stream with us, so they can ask your questions, the public's questions, and do the good work that they do in reporting back to the communities. So I'll hand it back to you, Sarah. Thank you.
First up is Sarah Reith with KZYX.
Okay, can you hear me?
Yes.
Yes.
Okay, thanks a lot for taking my questions. The first one is with the emphasis of the role of the state in managing the response, I'm wondering about the degree of uniformity in the response among the schools and the school districts. For example, if someone's got younger children going to school in Potter Valley and older students going to school in Ukiah, will the schools have the same protocols in place? And will someone from public health be working with the schools to liaise between them and the state to make sure that they're navigating this whole complicated process correctly and that their response is adequate?
Yeah, thank you, Sarah. That's a very important question. It's certainly a hot topic for the health officers across the state. We are working with our state leadership to ask for a meeting with the health officers, with the superintendent of schools for the state, to see how we can help the schools. I am not going to be writing the reopening plans for the schools. That is so specific to each school that it's not possible for me as the health officer to say what is going to be needed in each school to safely reopen. The state has come down with guidances for the schools, which the schools do need to follow. My health officer orders do not restrict, they're not restrictive in any way beyond what the state is saying. So I want to support our local school districts and schools to comply with the state orders. Having said that, there's a lot of gaps in the state orders that make it unclear what the schools should do. And there's also some expectations from the state orders that are difficult for the schools to know how to put into place. So therefore, yesterday, I did ask our DOC manager, Becky Emery, to meet with the schools, and she did have a meeting with the school superintendents to keep the communication going. We've had many meetings with the schools over the last months to ask, what are some of the concerns on the part of the schools and how can public health help? So what I'm saying at this time is that I would like the schools each to come up with a plan according to what the governor or the state superintendents is allowing, and then put those plans together all at one time so they can come to public health and we can review them together. And so I'm hoping that will happen in the next couple of weeks, that I can receive these plans all at one time, read them together all at one time, and then give my feedback and recommendations all at once. Because of course it would be very difficult if I was looking at one school district at a time and one school at a time. It would, I don't just, with all the outbreaks and all the other things we're responding to, there unfortunately just isn't the time to do it one at a time. But I do want to help the schools as a group, and we'll continue to do our best to support the schools. There's not easy answers. I mean, how do we have PE? How do we have school buses? How do we get kids back doing what they need to be doing? The answers aren't easy, but we'll keep working hard to try and find the safe ways for kids to come back to school.
Thank you. My next question also has to do with young people a little bit indirectly. We know that several teenagers have come down with this illness, and we haven't had any younger children in Mendocino County yet, but we learned that younger kids can get it and develop heart diseases. And of course, there's no way of knowing what the long-term effects of it are. So I'm wondering if there are any efforts or any plans to come up with a system to keep in touch with people who've recovered from the coronavirus so that we can understand what the long-term effects are, especially if this is going to last for a long time.
Yes, well, this would be the role of the primary care clinicians. So public health has a role in the COVID response. And, the primary care, the clinics, the hospitals also have an enormous role, because they're the ones who are providing care for people in an ongoing way. So what we do when a person is in isolation or a quarantine is our communicable disease team, if they're in isolation, calls twice a day. And if they're in quarantine, we call once a day. And the blanket isolation and quarantine orders, which are up on the county website, describe the periods of isolation and quarantine required. Isolation is 10 days, quarantine is 14 days. And in that way, we stay in touch with people during their isolation and quarantine period. But we also are always communicating with individuals that they need to be in touch with their primary care. If they don't have primary care, they have to establish primary care. And that's where those long-term follow-ups will occur, will be in the clinics and the primary care and potentially in the hospitals. One change that I did make in response to the governor's new mask, facial covering, and public order for the state is that I did make one change to my facial covering order, which came out over a month ago, which is I had made an exception for children under the age of 2, we do not ask children to wear facial coverings because we don't think it's safe. But I had actually made the exception for 12 and under, because I wasn't sure how well children were going to be able to comply with wearing facial coverings and how challenging that might be. But the governor's order is only making a child exception for under 2 and under. And so order that children under 12 should wear facial coverings, and that will provide some protection from children getting COVID. Now, again, wearing a facial covering, a cloth facial covering, doesn't protect the wearer, it protects others. But you can imagine if children are playing together and they're wearing facial coverings, then they'll be protecting each other. Now, just to make a comment, if you did have a social bubble, if you were really being very, very careful about your interactions and you had a group of 12 children and their teachers, a group of 12, a childcare bubble, for example, and you really limited those interactions for an entire month to just that group, that's where in my order, I say you do not need to wear a facial covering in that bubble. but a bubble can't go out to the store together because they're with other people then, right? So a bubble is really an isolated grouping where you're protected away from the public, and that's when we can drop that facial covering when we're with groups. Thanks.
All right, thank you.
Next up, we have Kate Maxwell with Mendo Voice.
Hi, thanks, Dr. Doohan, for answering these questions. So, we're moving into a new phase of opening, and that's going to include a number of what are considered higher risk businesses. But also in this last week, we've had a number of outbreaks, and we have definitely established community spread in the Ukiah area. And so I know you've said that you've noticed that people have not been complying with the mask order, and there's also been difficulty in having people who may have tested positive actually stop making contact. So I was wondering if you could maybe elaborate a little bit for just to help people understand how they can be safe with these new openings, and also what the county's doing to actually track and make sure that people who are testing positive, or how county staff is trying to contain these outbreaks as we open up.
Yeah, well, it is mandatory reporting for positive COVID tests. So the county to the county. So we know who's tested positive. And if they live in our county, we track that person down. People have been very cooperative with us once we identify them. They've stayed home once we've identified them through our public health outreach, and we call them, if they're a case, we call them twice a day. And they've been very cooperative with giving us their contacts, and we've reached out to those people. So that's the work of isolation, quarantine, and containing outbreaks that we do. So in terms of what the county is doing, we do that every day, and we've been doing it for months. The other thing that we do is the surveillance testing, which picks up cases that may not have been aware they had COVID, and then we do the same thing, isolation and quarantine. We also provide isolation and quarantine housing for free for people if they're not able to safely isolate or quarantine in their home. So that's on the public health side. And then, of course, the education, that's part of what we're doing right now, speaking to the public, wanting to make sure we have materials up on our website. We have infographics, we have posters you can put up in stores, and so on. Now, in terms of what individuals can do, and more as we go into this pandemic, there's individual choice that plays a big part. Individuals, individually can choose to wear a facial covering, to stay home when they're sick, to cover their coughs, to wash their hands, all these things that we talk about. This is very effective, social distancing. So these are things that we can do to stay safe as we have further opening. You can make a decision. Do you want to go to a higher risk business? A higher risk business is those that have recently opened up. These are businesses where it's difficult to social distance. That's simply how we define them as higher risk. It's harder to social distance in a bar, because of the nature of the social activities that happen in bars. It's harder to social distance in a bar than it is if you're going to go sit in the park and sit alone by yourself and, meditate. So when you do participate in activities where there's less ability to social distance, you're taking a risk, and you should realize that and decide whether you want to take that risk or not. The reason why we kept essential businesses open in the beginning of this pandemic is we understand that there is a certain amount of risk. We call them essential businesses, or, people have to get food. They're going to have to go to the gas station. So when you do these things, again, wearing your facial covering, washing your hands, all these things are important to being able to, go around your daily activities of life. Now, on the other side of it, we're working on public health with the businesses to make sure they have social distancing, they have hygiene practices, and that's been in partnership with ad hoc of the Board of Supervisors Sturdy and Williams, and the West Company have been helping public health to work with the businesses so they do a self-certification, and for the higher risk businesses that they post their plans for how they intend and commit to making their businesses safe for people to come in and be in. So Enforcement is, of course, a big challenge because we're not going to be arresting people for not wearing a facial covering. However, there are things that we can do for businesses that ignore the sheltering in place orders in terms of, going through environmental health and having complaints. And so this is all something that we're working out across the state of California, including in our county. How do we enforce the sheltering in place orders while keeping a peaceful community and while making sure that people are cooperating? So I don't know if I've answered your question. It's a very complicated question about how do we stay safe in the pandemic, but it's certainly what we think about every single day in public health.
Thanks. Yes, it is a complicated question. I guess I did want to clarify one piece of what you said earlier in regards to that question, where, you alluded to individuals who had in some way not been following recommendations, and therefore there's a greater number of contacts who are now either in isolation or in quarantine. So I was wondering if you could, just spell that out for people a little bit more in terms of what you mean by how people should act, or
Well, following the orders, the health officer's orders is how you should act. And so if someone ignores that, for example, I don't want to wear a facial covering, I don't want to stay 6 feet apart, I'm going to go to a party with 35 people, hang out, and then go play basketball with my friends, and then you find out you have COVID. Now we have to track down every single one of those people. And now they're having a harder summer because they're home under isolation orders of the health, or quarantine orders of the health officer. So a person may not be aware that they have COVID. And by doing those activities, once they get diagnosed, there's a lot of people that are impacted by that disregard for the health officer's orders. And we'll be seeing that, I think as we go into the summer, we'll have more outbreaks if people decide not to follow the orders. And, it's very, very unfortunate, but we're trying our best in public health to make very clear what the expectations are. They are orders, and to really, beg people to follow them. Please follow these orders. Please take care of our community. And to highlight that who's at most risk of dying? It's our grandparents, it's our elders, people who are afraid to go to the grocery store because they see people not wearing facial coverings or social distancing. They're elders who are living in terror, really, of this disease. So we need to take care of them. They're a higher risk, to make sure we have a safe community for everybody.
And so I guess as we're moving forward, and we can anticipate there will be more outbreaks. There likely may be more community spread in other parts of the county as we get more tourists, or there's more mobility. Is there any consideration to providing more information in terms of details to the public about sort of more specific locations if we start getting outbreaks in specific businesses? Will that be something that will start becoming more available for people?
That's an excellent question. Thank you for asking that question. I will reveal the name of a business or a location where there's been an outbreak if I believe that there's a risk to the public. So for example, if the individuals that, let's say, let's just take an example, that there was, let's just say, this hasn't happened, okay? Currently, this does not occur, but let's say that there's a hotel that has an outbreak. If that hotel, and that's not the case, so I'm saying this is a hypothetical, did not comply with the health officer orders, did not, isolate that individual who had COVID, shut down that room, do all of the things that are required, then I would announce this hotel is not complying with the orders, and it is not a safe place to go. I would shut down the hotel. I have that authority as the health officer, and it would become public. That's not anything this is a hypothetical, okay, just to make that clear. But it is the health officer's authority to reveal the name of a business or a place, and to actually even shut it down if they're not complying with the health officer's orders, and it's a health risk to the public. We don't have that in our county at this time. I'm very grateful. So there's nothing for me to reveal to you, because there's nothing that is risking the public. Everybody that should be in isolation is in isolation. Everyone who should be in quarantine is in quarantine. And there are no businesses that have outbreaks in them that are of public health concern at this time. But that would be the circumstance that I would reveal it, a public health risk.
Okay, great. Thanks so much.
Next up, we have Matt with KMUD.
Hey folks, thanks for hosting today. My first question is for Dr. Doohan. Just to be frank, I sense within your statement today, I don't know, a sense of urgency. I'm wondering if you could kind of speak to that sense of urgency. This is sort of a multi-part question. I'm wondering if you see the community's decisions right now as telling of the trajectory of Mendocino County's COVID-19 experience. And then with that, knowing that our attestation was approved by the state, I'm kind of wondering, along with a sense of urgency, how many cases and hospitalizations would actually need to occur to overwhelm our current medical infrastructure capacity?
Well, I do have a sense of urgency because I wish I could have my fantastic communicable diseases team on live stream with us one time, and you could see these heroic individuals who are working behind the scenes so hard, day and night, all through the weekends, responding to the outbreaks. So when I tell you we have 18 individuals in isolation and 57 in quarantine, that's a lot for a rural county to be handling with our communicable diseases team. And thankfully, we have done training for case investigation contact tracing, which helps us a lot because every one of these came, all the quarantine individuals came through case investigation contact tracing. So there's a very heavy burden on our public health department as we have more active cases and outbreaks, and this gives me a sense of urgency. Furthermore, we do have tourism opening up. We can't stop it really. And we have competing pressures really. We have the pressures of public health, which would, frankly, if public health officers did exactly what they thought using their oath and what they've pledged to, we wouldn't open up for a year. But we can't do that. We understand we can't do that. And then we have, the business community who needs to feed their families and they need to keep their businesses alive. So we have to balance this on both sides. So we are opening up for tourism. It's happening. And this is very concerning to me because as I said, 17,000 cases in the Bay Area. We're inviting this into our county and it's going to happen. So the only way that we can protect against a tsunami of cases in our county that would overwhelm our system will be for us in Mendocino County to be very, very careful with our own personal practices. And that's what I'm really imploring everyone listening to do, to wear the facial coverings, to practice the social distancing and the hygiene, stay home when you're sick. In terms of the number of cases, it really has to do with how fast they happen. So if we had 100, so we're seeing about a 10% hospitalization rate of our positive cases. So if we had, 1,000 new cases all at once and 100 hospitalizations all at once, this would be very difficult in our county, to have 100 COVID patients all at once. So we need to just keep flattening the curve and slowing the spread. And while you do detect the urgency in my voice, I also want to say that I am feeling very proud of our public health team. We are seeing that we are continuing to contain outbreaks. So while we have had these recent outbreaks that I mentioned, we're not seeing evidence right now that they're not contained. It seems like we have contained them through the good behaviors of all of the individuals who are cooperating and isolating and quarantining. And thank you very, very much to them. We appreciate what they're doing so much because that action of quarantining and isolating is one of the most important things we can do. We need people to stay home when they have COVID and their contacts to stay home. So thank you to those 57 people in quarantine in our county and those 18 in isolation. Thank you.
Thanks for addressing that, Dr. Doohan. The next question I have is getting back to schools and the California Department of Ed 64-page document issued to schools regarding reopening in the midst of the pandemic. And, reading the document, they're giving room for each district being allowed to implement the guidelines that are most appropriate for their clients, for their community. And I'm wondering if you know, as a public health officer, thinking about the budgetary circumstance that we're in and the overwhelming amount of guidelines that are being recommended, you know, if you had to simplify that document into 3, 5, just like essential guidelines, what would those be for local education institutions?
Yeah, well, for one thing, I and the other health officers are asking our state, organization to convene a meeting with the state superintendents of schools, so we can get that exact guidance from the state superintendent of schools to share, so we can have a unified message to our communities. Certainly, we could break it down to rural communities. I mean, in Mendocino County, there's nothing like what you might see in Alameda County, in our county. It's very different. So I think if we had, a grouping of rural communities where we could come up with these solutions that the health officers could unify and help our great leaders in our county that are doing the hard work of leading for the schools, I would want that. So number one would be asking for some help from the state, but more help. But just bottom line, the social distancing is effective. It's very hard to do with children. So to the extent that we can social distance in the classrooms, this is going to be important. To the extent that we can have ventilation, open windows, this is going to be important. Hard to do in the winter, right? To the extent that we can have extra opportunities for hygiene for the children, extra hand washing, not sharing crayons, not having shared surfaces, wiping down surfaces, this is going to be important too. And ability to stay home when sick. So, I mean, it's just so challenging. It's hard to know what the 3 would be. I will say that it's going to be a hard school year. There's nothing that's going to be easy about it. And I will continue to pledge to do my part and our public health's part to support the schools and to continue to be here, to be a sounding board. And we just have to go on this journey together as we look at reopening schools. I don't think there's clarity right now. Unfortunately, I don't have a good answer because there's not clarity at this time.
Dr. Doohan, really quick follow-up question. Are there any guidelines you saw outlined in the 64-page document, knowing the limited nature of the fiscal resources school sites are dealing with, that you would recommend aren't necessarily worth putting resources towards? I don't know, temperature screenings. I don't know. That's the hypothetical that I just.
That's probably the one. Thanks for bringing that one up. The temperature screening has not shown to be effective because fever tends to be a later presentation with COVID. So if there is one, it would be temperature screening. One of the things we've seen with our governor is that there may be a response that comes that could be good news, maybe more budget, more funding to come from the state to help our schools at the county level to implement these changes. But definitely temperature screening would be one that I would say let's not do, where just having parents have the ability somehow to be able to keep their kids home when they're sick is going to be another challenge, but that's what we need to do. Parents and teachers, kids and teachers to stay home when they're sick and have a way for those individuals to be able to continue participating in schooling from home.
Thank you.
Next up is Jackie Orozco from El Punto.
Thank you so much for having Periódico El Punto participating in this conference. And thank you so much for the county to start publishing flyers in English and also the video with George. Thank you so much. La primera pregunta es, para hacer una cita por internet para la prueba de COVID-19 es complicado para llamar y también un poco para llamar por teléfono porque hay un mensaje que te dicen que si tienes internet, la cita la tienes que hacer por computadora. ¿Están reconsiderando hacer este trámite un poco más fácil para aquellas personas que que no saben cómo manejar bien la computadora como para hacer una cita en internet y pues para que no se desanimen en hacerla. Y si una persona ya se hizo la prueba una vez, para las siguientes ocasiones, ¿va a ser gratis o le van a cobrar?
And are you, Jackie, are you speaking about OptumServe? Yeah.
Sí.
Okay.
Yeah.
Okay. Making an online appointment for COVID-19 test is complicated for people who do not have computer skills. And when you make a phone call, you hear a message saying that if you have internet, you need to make your appointment online. If the county considering to simplify how to make an appointment in order to do not discourage people to get tested, is the second part. The same question is, if a person got tested and need to be tested again, is there any charge for the for testing again?
There is not a charge for retesting again. And I would like to ask Carmel Angelo, who I believe is still in our live stream, there is a way for people to call in to make an appointment for OptumServe where they do not need to enter the information online. So I'm sorry, I don't have that information on my fingertips, but let's be sure that we get that before we sign off today. There is a way to call in for the appointment.
Okay.
So we'll make sure we give you that information before we sign off.
Okay. Okay.
Dr. Doohan?
I think, do we hear Carmel?
Yes. Did the information to make an appointment with Optum is the lhi.care. However, you can always call. Even if you have internet, you can still pick up the phone and call. And that number is 888-634-1123. While we discourage walk-ins, and the preference is always to make an appointment, if you happen to be in Ukiah on a certain day and you hadn't made an appointment, you can always walk in for a test. Again, the tests are free. It's at the Redwood Empire Fairgrounds on State Street in Ukiah, and it's Tuesday through Saturday, 7 a.m. to 7 p.m.
Okay.
Dr. Doohan, additionally, we do have a Spanish-speaking staff there.
Okay. Okay, thank you. Bueno, con relación a la pregunta, sí hay una opción para hacer citas por teléfono. El número de teléfono es el 888-634-1123. La idea es primero hacer citas, o sea, hacer una cita para poder hacer el test. Ellos tienen la preferencia. Sin embargo, si hay alguien que viene de visita a la ciudad de Ukiah, puede presentarse y hacerse el test también. Pero la prioridad es a aquellos que tienen cita. Ya sabemos que ellos están localizados en el campo ferial de acá de Ukiah. Ellos atienden desde el día martes al día sábado de 7 de la mañana a 7 de la noche. Y con relación a que si alguien se quiere hacer el test por segunda vez o tercera vez, es completamente gratis.
Okay. Entonces, si cuando llama a la gente por teléfono y dice si tiene internet, tiene que ir a la computadora, como de todas formas puede hacerlo por teléfono, ¿verdad? Si es más conveniente para la persona. Exacto. Y es en los términos de la feria de Ukiah.
Exacto.
Bueno, entonces la segunda pregunta es, sabemos que todavía no terminamos esta primera ola de COVID-19. Nos han estado preguntando si el condado está realmente preparado para una segunda ola de COVID-19, que en la conferencia pasada nos dijeron que era probablemente en el mes de septiembre, después de Labor Day, después del día de trabajo.
Okay. Is the county prepared for the second COVID-19 wave?
Yes. I mean, this is what we've been doing for months now, is preparing. And this is why we're so grateful that our community has been so cooperative in slowing the spread and flattening the curve, because it's given us time to prepare. And there's many ways that we've prepared. You know, while I am very concerned about the outbreaks that we've had this last week, I am also very pleased at our public health response, because the evidence is we've contained, yet again, we've contained another outbreak. So this would not have been possible 3 months ago, to have this type of response, this type of response to contain this many cases. But because we've had time, we've grown our case investigation contact tracing team. We've really, our communicable diseases team has become very expert at managing the patients that are on isolation quarantine. We also have more testing resources. So everything we've done, all of the hard work we've done, our team has done in the public health department and our DOC and our EOC has prepared us. As well, on the other side, the clinics, the hospitals have been preparing. So we are prepared for a surge, but the point is we don't want it to happen all at once. We need it to happen slowly. And the way that it happens slowly is with isolation and quarantine, with more testing so we find cases that didn't even know they were sick, and the free isolation and quarantine housing that we can provide so that people aren't in crowded households when they're sick. So this is one of the ways that COVID spreads very rapidly, is in households where a sick person can't be in isolation at home. So we have housing for that, that we've been able to provide. So everything we're doing is helping us get ready for this wave. And what we need to do is have it be a slow wave that just comes nice and gradually slow, because we know it's going to come. And the slower the wave, the more time we have to get a vaccine. And ultimately, that is going to be what gets us out of the pandemic, is a vaccine.
Ok. Bueno, la respuesta es sí. Sí estamos preparados acá en el condado. Y acá hay varios factores que juegan un rol importante para estar preparados y para continuar en esta ruta. La respuesta que está brindando la comunidad hasta el momento es fabulosa. Ellos están colaborando, ellos están aislando, los casos están poniendo bajo cuarentena. Si, por ejemplo, no hay las condiciones en ese hogar de que la persona que resulta positivo y no hay condiciones que se pueda aislar allí, nosotros le estamos ofreciendo que pueda salir de la casa, le ofrecemos un hotel para que esta persona evite estar en contacto con ellos y transmitir la enfermedad a la familia. Igualmente también aquí en el Departamento de Salud Pública y en particular la Oficina de Enfermedades Infecciosas, tenemos personal preparado, han sido entrenados para hacer seguimiento de casos, para hacer investigación de casos. Tenemos suficiente cantidad de pruebas de laboratorio, tanto por la compañía que está en el campus ferial, como aquí también en el Departamento de Salud Pública. Las clínicas también están preparadas, los hospitales también están preparados para poder nosotros, de manera conjunta, detener el avance de la enfermedad. Lo más importante es que si van a haber casos, pero la idea es que estos casos aparezcan de manera controlada, de tal manera que no haya una curva de pronto de muchos casos que sea difícil para nosotros poder manejarla. Si estos casos van apareciendo gradualmente, entonces toda la capacidad que tenemos instalada va a ser posible y controlar que estos casos sigan expandiéndose, hasta que finalmente podamos tener la vacuna y que la vacuna finalmente va a ser la solución a esta pandemia.
Gracias, George. Thank you, Dr. Doohan.
Okay.
Thank you.
Thank you, everyone. That concludes Friday's Friday Update. See you next week.